Hey, hello everyone. Welcome to Health Korea Solution once again. So this would be a very comprehensive platform to provide you all the medical coding guidance on US healthcare. So today we are going to talk about the types of medical coding that generally US healthcare is to deal with. Okay? So when it comes to types of medical coding, first of all, we would be dealing with the general types, though there are many other types of the medical coding based on their different areas of expertise. But today we will just talk about the general types of the medical coding based on their nature of the coding. Okay. Now, first one being the diagnostic medical coding, second one being the procedural, and third one being the pharmaceutical. Okay. Now, when it comes to diagnostic medical coding, it is nothing but the ailment, the diagnosis, or the disease or the syndrome that we generally refers to. Say, for example, I take the name of a diagnosis like diabetes. It's the most common disease nowadays. Or I would take like influenza. I would take like the hypertension. I may take the example of joint disorder, or anything that causes a disorder in your body. That is nothing but the diagnosis. Now, to convert that diagnosis into universal code in order to reimburse or pay to the providers, from the payer side or from the government side, that is called as the diagnostic medical coding. When it comes to procedural medical coding, it is nothing but the surgical part of the medical coding. It has everything to do with the surgery. Now it could be related to your fracture surgery, it could be related to your tumor excision surgery, it could be related to your heart surgery, the cardiothoracic surgery, or anything that has to do with any part of the body that is related to surgery. Okay, that is dealt with the procedural surgery coding. Now when it comes to pharmaceutical coding, it is nothing but the drugs or the medicaments or any other biological product that is being used to treat, okay, to treat the diagnosis. So we are coding for those components. Now why are we coding that? In order to understand or determine the safety and efficacy of those pharmaceutical product. That is, in nutshell, I would say it's for the pharmacovigilance purpose. Okay. All right, so let's look into the detailing part of the diagnostic medical coding. So this diagnostic medical coding, the codes will be like alphanumeric. Okay. Now how it would look like? Say for example, earlier in ICD 9 cm, it was completely used to have numeric values. But currently the diagnosis coding what we are using is related to ICD 10 cm, which has alphanumeric value. Now, if I take an example of the common disorder diabetes, I would arrive to a code called E11.9. If I take an example of the hypertension, I would arrive to a code that looks like I10. So I being the alpha part and numeric being the 10. Okay. Similarly, we have like symptoms code like fever and all, like headache, dizziness, like R22, R51 being the headache. Okay. Now, when it comes to procedural coding, we would look into the CPT, the PCS, and the HCPCS. Okay. CPT stands for current procedural terminology. We have a completely separate book of the CPT. The way we have diagnosis coding, we had a completely separate book of the ICD 10 cm. Similarly, we have in CPT coding, in this surgical coding, we have one part is CPT. CPT, we have a complete book of the CPT, that is current procedural terminology. And this book is being revised every year, okay, in January. I mean, there would be some deletions, there would be some additions to the code, okay, there would be always an upgradation, okay. Now, this CPT includes only numeric codes that are that are generally that has to do with the medical services, interventions, and the procedures. Now, let me take an example of a simple procedure, that is biopsy. Now, biopsy we generally perform to identify or to determine the disease. What is that ailment? Okay, if I take a tissue, whether that tissue is cancerous or non-cancerous or a simple tissue, I would be able to determine that. So for that purpose, biopsy is being done. Sometimes for therapeutic purpose also is done, but biopsy itself, it's an intrinsic kind of procedure. Okay, but this is done to identify a diagnosis, right? So biopsy being the procedure, we will perform the coding for biopsy. So CPT coding, when it comes to CPT coding now, 10021, that would be the code for the biopsy. Okay, biopsy of a particular part that would be documented in your CPT book, okay, or CPT manual. Okay, now that includes, this particular CPT book includes the chapters based on types of healthcare facilities. When it comes to healthcare facilities, we have many facilities like emergency department, inpatient, consultation, critical care, anesthesia, surgery, radiology, pathology, or medicines. Now all this will fall under the CPT coding. Okay, now this CPT coding would be done only by the CPT coders, not by the PCS coders, not by the, I mean, this HCPCS. This will fall into the CPT coding at times whenever they would do a kind of combination coding. Okay, but PCS and CPT, these are two different types of coding. A PCS coder will never do the CPT coding until or unless there are exceptions, and CPT coders will never do the PCS coding. That's for sure. Okay. Now, when it comes to PCS coding, it includes alphanumeric codes. Okay, on the medical services, interventions, and the procedure, same as the CPT coding, but the nature of this coding or the approach of this particular coding is completely different than the CPT coding. The surgery which were not at all covered under the CPT coding, or the uh, what do you call, the narrowness of that CPT coding has been widened with the help of PCS coding. It has covered almost all types of surgery which were not earlier covered by the CPT coding, and that is the only reason why PCS coding is considered as the most superior types of the medical coding, and it is the highest paid coding in medical coding market. Okay, now if I take an example of the laceration repair of the face, okay, so this would be that's how the entire PCS code look like. Now this PCS code would have like 0HQ1XZZ. Here, like it has like totally 7 characters, right? So 0 may stand for like medical and surgical, H may stand for the body system, which body system actually they're doing, like skin, right? So here Q is like the root operation, what exactly operation they are doing, like laceration. Then 1 may stand for the body part, which part are they doing, that is face. X may stand for the generally that would stand for the approach, what kind of approach they are using, whether it is open approach or percutaneous approach. Z may stand for like the device, any device if they are using. If they're not using, it will be Z. And if they're any qualifier, anything, the last Z would indicate that qualifier. Okay, now this would have sections based on the medical and surgical, obstetric, placement, measurement. Now this would generally require, in order to understand these sections, you need a very detailed training in PCS, and which is a bit complicated. Okay, probably we will come up with in our further training videos to help you understand at least a bit of all these types of the medical coding. Okay, and we would also have like further videos where you can understand, even a layman or even a fresher who would be able to understand the types of medical coding, whether it is diagnostic, procedural, or the pharmaceutical. Okay, so always stay tuned. Our next topic will be based on the coding specialties with respect to their books, facilities, IP, and the inpatient and the outpatient being used. So please do like, share, and subscribe, and please do not forget to put your comments or feedback in the section below. Okay, you would always have a very comprehensive and detailed videos on medical coding from this particular channel. Thank you very much.